Well, good evening, everyone. How are you ladies doing? I always forget to turn my volume down. Glad to be with you tonight for Wellness Wednesday. Hope everybody can see me and hear me okay. And as we're waiting for, okay, looks like we're okay, good to go. I am going to say my disclaimer, and we will get rolling. And so, anything that I say tonight during this Wellness Wednesday is not is not health advice, but merely health information. So, if please do not stop taking, or change the way you're taking any of your medications either. If you feel like you need to do so, please first consult with your prescribing practitioner to make those changes safely. And by attending this Wellness Wednesday, this does not establish a doctor-patient relationship. Okay. And I'm going to touch on a really important topic, but before I get into that, I needed to let you know. I'll probably end up having to say something as well in the group tomorrow. And this probably doesn't even apply to you ladies who are watching tonight, but I do need to say if any of you have got your lab testing ordered and you're waiting to meet with me or my team, please get those labs and done right away. Your intake forms, your saliva test. Just don't wait. If I've had a lot of people say, "Well, I don't have time," or it's been I've got this and this going on. If this is your priority, if your health is your top priority, make that happen. All right. So we're looking forward to meeting with you. And hopefully, if any of you are listening to this, then you'll be able to get it done. And that way we don't have to reschedule your report of findings, your visit consultation with us. Okay. All right. I'm going to ask a question or read to you a question that is the basis for tonight's topic, this discussion on iodine. And the question goes, please tell me why I'm allergic to iodine and the fact that my thyroid is very small, like 2 Ps. Why would this be? I have Hashimoto's and I take 150 Synthroid. Thank you. I just wonder, is there a connection? So, ladies, I'm going to start by asking this question. Can someone be allergic to iodine given its necessity for thyroid function? All right. So let's think about that. The short answer is this: true allergies to elemental iodine or iodide are extremely rare and just not well documented because iodine is a naturally occurring essential trace element required for making thyroid hormone. But adverse reactions to iodine containing substances, for example, iodinated contrast media, used for CT scans, povidone iodine or betadine, shellfish, all right, are often mistaken for allergies to iodine. These reactions are typically non-allergic, meaning they're more toxic reactions, irritant type reactions, or sensitivity based due to other compounds in the substance and not the iodine itself. Okay. So first of all, what's the difference between a food sensitivity and an allergy, a food allergy? So this is a really important question to understand this whole immune response. First I'll tell you, most of you don't have an obvious allergy, all right? An allergy would be when you get like an anaphylactic reaction, which, by the way, is called a non-IgE reaction, or something happens instantly, like a skin rash or hives, right? But that's not what usually happens when we have sensitivities to foods or these elements, right? A sensitivity usually causes inflammation over time. And you may not even see a symptom. It can be a very delayed reaction. But when it comes to iodine, it's a critical component of thyroid hormone. And we require around 150 micrograms per day. All right. We're going to have some fun. I'm going to go into this whiteboard and share this. Um, oh, that was the wrong thing. Okay, we're going to go into this whiteboard and I'm going to do some drawing for you. Just 1 second. It's having me sign in, so we'll do that. Second. Almost there. They're making me sign in, so give me just a second. So I didn't know it was going to have me do this. That's the issue. I was already logged in, and so we're gonna see if we can get logged in here. While we're waiting on that, I will be taking a few questions at the end. So if you have any questions related to iodine, not like real personal question, but if you have general questions, please make sure we can ask those at the end. All right. I may need Cherry Ann to get me that code. Check your email, Cherry Ann, please, and let me see if that's where that code was sent. Okay, good. All right, here we go. We're going to have some fun. So, this is what we would call a thyroid molecule. All right, thyroid hormone molecule. Um, Let me know if you can see that. Okay. Cherry Ann, can you see that okay on your end? That's disappointing. Okay. Um, when you practice something beforehand and you feel like you've got it good to go, this is what I need you to understand about thyroid hormone. You have two you have two tyrosine molecules. These are amino acids. And you have four or three, okay, iodines attached to it. So what I wanted to show you, wanted to draw a little bit, but we're not going to get to that. Wouldn't let me log in properly or let me show you properly. This is T3, where you have three iodines attached to this tyrosine combination. Four iodines is T4. All right. It's absolutely essential that you have iodine to make thyroid hormone. And then reverse T3 would be something like this. So it's a different configuration of that. And that should help you understand that there's a difference between these markers. You know what the difference is? It's these iodines attached, all right? Say my ears or the tyrosine, they're attached to those amino acids. And so when you lack iodine, you may not be able to make enough thyroid hormone. And when you have too much iodine, you may have some adverse reactions, or it may cause your immune system to be kind of funny with it. And this is one of the causes for Hashimoto's. Okay. So it's very interesting how this works. Now, I'm going to get into a couple of things with this that will shed some light on um, why we get confused about this. Iodine is found in blood and your tissues and in thyroid follicular cells, right? So a true IgE mediated reaction to this essential element, iodine, would not be advantageous from an evolutionary perspective, would it? For the survival of our species. Think about that. It would really mess things up. Now, when someone reacts to, say, iodine contrast media, like for a CT scan, it's a reaction to another part of the mixture or substance of the contrast, or a molecular side chain of the iodine, but not to the iodine. Okay. What about shellfish? Some of you have allergies to that. And is this really an allergy to iodine? Once again, this allergy is always to proteins in the fish itself and not to the iodine. It just so happens that these fish are high in iodine, and the iodine allergy myth often just leads to unnecessary avoidance of, say, getting that contrast dye to be able to get a good test, or to getting proper iodine supplements when you really do need them. So reactions to food or supplements, some considerations there. High doses over 1,000 micrograms per day can lead to just too much iodine in the system, or too much for what the thyroid follicular cells can handle, leading to a metallic taste, rashes, stomach or GI upset, other symptoms as well. So let's answer the question I presented in the very beginning. The question was, again, please talk about why I'm allergic to iodine and the fact that my thyroid is very small, like 2 peas. Okay. So what would be this connection? Is she really allergic? So because her thyroid has literally shrunk, and this happens, I was talking with a patient, it's been several months now, and she had a repeat thyroid ultrasound done, and the radiology technician asked her where her thyroid was. And she said, well, what do you mean? And he said, well, I don't see a thyroid. It basically had shrunk, right? And so this is what happens when you have Hashimoto's. And she had had a test like years previous, like 10, 15 years previous, an ultrasound, and her thyroid had literally shrunk to almost nothing. Okay, so like this lady says, the size of 2 peas, like that, it's like that kind of thyroid, that small of a thyroid is not going to be able to handle much iodine, is it? There's going to be a lot fewer follicular cells in the thyroid to manage processing about 150 micrograms a day, which is what a normal thyroid will process. So it makes sense if there's a much smaller, say it would be this big, but now it's like super small. There's much less capacity in a thyroid gland, which stores most of the thyroid, to process this, right? And to make enough hormone. So we need iodine for thyroid function for sure. This is why you can have a skin rash reaction to povidone or betadine iodine, but still be able to consume like iodized salt or eat shellfish. These don't trigger the same response because it's a reaction to the povidone or other additives in that, or other proteins in the shellfish, not the iodine. So skin tests, skin prick tests, right? Or patch testing for specific allergies, like some of you have had may be helpful for the substances, but blood IgE tests are not helpful. All right. Most iodine allergies are reactions to complex molecules like these, like the iodinated contrast or povidone, or not the elemental iodine or iodide. These reactions don't interfere with the thyroid's ability to use iodide for T3 or T4 synthesis. So this is iodine. This iodine allergy is a misnomer. And they've even started labeling contrast dyes, like this. That this is actually a misnomer. Many have asked me as well, what about blood testing for iodine levels? So rapid clearance from the blood by thyroid, the thyroid gland by sodium, and this is through what's called the sodium iodide symporter. Rapid clearance from the kidneys or salivary glands or breast tissue makes blood testing inaccurate, as levels will constantly fluctuate, right? Concentrations are low in the serum as well, and thus standard lab tests really do lack precision when it comes to measuring trace amounts of iodine, leading to high variability and more error, right? Then you can have interference from binding proteins and other compounds in the blood that affect lab tests, because iodine is a free ion in most states in the blood and easily binds to these proteins like albumin. And then you have, the fact that thyroid stores 70 to 80% of the body's iodine. And so serum iodine levels don't reflect those stores, right? So the blood tests really do, fail to truly capture a functional iodine pool, again, which is critical to thyroid hormone production, right? And so they're unreliable for assessing how much iodine you might actually need if you're actually deficient, or if you're not deficient. Maybe you're dealing with too much. Then there's drugs and lithium and other drugs and toxins, mycotoxins like ochratoxin A. These can affect iodine levels and gut absorption from food sources. That's like specifically ochratoxin A will decrease gut absorption from food sources, and kidneys excrete around 90% of ingested iodine too. So depending on kidney clearance, iodine may be falsely elevated or reduced. Okay. Now there is a 24-hour iodine concentration test, but we only really do these for patients in our clinic if warranted. This is not a screening test. Now, what do? Well, you've got to monitor thyroid. So you check all the right thyroid markers to really assess iodine's functional impact, especially if you're on thyroid medication, replacement hormone therapy for the thyroid. So the other thing you have to be sure to do to manage this appropriately is to ensure that you're getting around 150 micrograms per day from your diet, like through seafood, fish, or kelp or seaweed. Eggs are a source of iodine. Green beans, spinach, beef liver, chicken and pork even. And then you want to certainly avoid excess, meaning don't go above 1,000 micrograms per day from supplements, especially where a lot of you tend to go, including kelp. Okay, kelp supplements are really popular right now. If you're thinking, well, I eat plenty of salmon, tilapia, those salmon, tilapia, trout, any freshwater fish are generally not even small sources of iodine. So those don't even count. Okay. Now, there are a few signs and symptoms I want you to be aware of that may warrant iodine supplementation, or at least, getting more in your diet. So these include fibrocystic breast disease or breast lumps, ovarian cysts, uterine fibroids. Now, if you have a goiter, the bulge or just a band around the neck, that's definitely an iodine deficiency. Slow speech, enlarged tongue, or like with teeth impressions on the sides of your tongue. And puffy face or puffy hands can be a sign of iodine deficiency. Now, I'm going to go back and talk about this molecule, this thyroid. Now, I can't show you on the whiteboard. I'm super sorry. I really wanted to do that, and I'm not sure why it won't let me log in or let me share it. But you have these iodines. Say this is T4, okay, 4 iodines. And now let's talk about the effects of other halogens and how they affect iodine metabolism and how this can relate to Hashimoto's. So, first of all, when you have too much iodine, that's one way that that can cause Hashimoto's. All right. So, too much supplementation. Now, let's talk about fluoride, bromine, fluorine, bromine, and chlorine. Let's keep it simple. So, these are elements that are just above iodine in the table, right? In the periodic table of elements, taking you all the way back to chemistry. So, where do you find fluoride? Where do you find bromines and chlorine? Well, a lot of this is in our water. Bromines and chlorines, these are in pesticides. These are in dioxins. These are in many different chemicals, right? These are all over the place. And they can, again, mostly we get them from water and from our food. So we get exposed to these halogens, which have a stronger capacity. So here's iodine here. Here's fluorine, bromine, and chlorine right down here, right up top, above the iodine on the table. When anything above something on the table of elements will have a stronger binding capacity, binding strength. And so fluorine has a really strong, and chlorine, then bromine, and then iodine. So in order of strength, fluorine's going to be able to displace iodine from a thyroid hormone molecule or in a thyroid peroxidase enzyme that's taking iodine and putting it onto the thyroid hormone. Okay. So now we're talking about a disruption in the endocrine function. And this is going to look bad to your immune system. It's going to look abnormal. You've got this big fluorine attached now, like let's say it's this instead of this. This fluorine is going to attach to that hormone and it's going to look funny. Or to the enzyme that attaches it to the hormone, that enzyme is going to look funny, that TPO. So guess what? Your immune system sees something wrong and it wants to protect you. It wants to protect the thyroid from that ugly fluorine or bromine or chlorine. And it's going to make an antibody. And this is how autoimmune disease, Hashimoto's in particular, this is how Hashimoto's is born. And so we we must stay away from these halogens, all right? This is certainly going to cause a buildup of iodine in your system as well, and that can lead to reactions also. So the buildup of these halogens, fluorine, chlorine, and bromine, apart from iodine, can certainly lead to reactions as well, and certainly lead to autoimmune thyroid problems. Okay. All right. Iodine supplementation can be pretty controversial as well because there's a lack of understanding here. So some practitioners refuse to supplement with iodine. Some take it overboard and really supplement with too much iodine because they don't understand some of these other things. So it's really important that you have someone that's got an understanding of this. Okay. So that's iodine. Now, I'll answer a few questions. Let me see what we've got. Okay, I'm just reading one off the comments. Can fluorine be prevalent in well water? Not really. Most of the time, well water is free of those halogens. Okay. Um, and and it's, you know, It's got a lot of other problems potentially, but yeah, it's generally free of those halogens. So let me go to the questions. Should we take iodine drops with hypothyroidism or Hashimoto's? So again, that's a very difficult question to answer. That I don't have a blanket answer to that. It's got to be very individualized. So if you do have some of those symptoms that I mentioned that might warrant further, looking into this further, um, it may warrant further testing, and it certainly can be helpful if you're just short to stick with 150. Try to stick to getting, at least 150 micrograms. And you can look this up. Dr. Google's pretty good for some things. You can look up and see, well, how much is in some foods, that you're thinking that I just mentioned, like green beans and I don't know how much is in green beans, or it would depend on the serving, of course, too. So that certainly you can look up. So if you're good about getting enough iodine in your system, so if you're getting about 150 micrograms into your daily, consumption, then you probably don't need to take iodine drops if you have these problems. So, but like I said, it's going to be better to get it if you do need to supplement. Probably better to get it in the form of kelp supplements because it's organically bound and it's not in a salt form. Iodized salt is not the best way to get this. Okay. This is one reason why this led to, so they did studies, they supplemented people around the world that were low in iodine with iodized salt. And then after a while, they retested them and 90% of them had Hashimoto's. So it's like, did the iodized salt cause the Hashimoto's because it was just not something the body could process and it looked funny to the immune system? Possibly. All right. There's no real good answer. This hasn't really been revisited a whole lot with these studies. So, what about seaweed is another question. And seaweed, kelp, all these are good sources of iodine. But do you need to be careful of this, of supplementing with this? And yes, the answer is going to be yes. You don't want too much either. All right. How does the skin test with iodine absorption work? So I think you're referring to putting some iodine and seeing how fast it absorbs into your skin. I used to try to figure that out because there's all these different recommendations for, okay, if it absorbed within an hour or within 6 hours or within 12 hours, that there's all these different rules. I never could find a good consensus with that. And so I'm not going to endorse the skin absorption test. It's there's so many different rules. I don't know which rules are right. There's no studies that have been really done on this very well. So um, I'm going to leave that there. So how do you test for iodine deficiency? Like I said, look for symptoms, and if you have some of those symptoms, then maybe we can do a 24-hour urine collection, iodine concentration test. Okay. Um, it is a test that's available, but we would only do that for, if you were a patient. Let's see. And it's a specific urine test. With hypothyroid or Hashimoto's, should you not spend much time in a chlorinated pool? No, yeah, that's a great question. So I would limit, yeah, your time in a chlorinated pool. You're going to absorb some chlorine and sometimes bromine. They use sometimes bromine in pools as well. If you can find a pool that's mostly salt water, I mean, yeah, some of that can still turn into chlorine, but that's going to be a better option. And I know some YMCA's around the country do have salt water versus chlorine cleaned pools. Do you have a favorite water filter? Um, for for getting rid of fluorine, bromine, chlorine, reverse osmosis is always going to be one of the best, but still even better is going to be distilling the water. Um, the Berkey ceramic filters work really well for removing fluorine, bromine, and chlorine as well. Okay. Those are going to be my favorites. But you have to get the Berkey. It's a canister system and you have to get the ceramic filters for that. All right. Do I see any other questions? So as far as iodine goes, guys, it's absolutely essential for thyroid function. Uh, Most of the time, we are really not deficient. Let me say that. Most of the time, because again, our thyroid stores 70 to 80 percent, I think I said, of your body's iodine. Uh, it's you probably have enough. All right. I would say few patients really do need um, significant iodine supplementation. Um, It's hard to say. We have a really good one of the supplements I know that we use does have 150 micrograms of iodine in it. And again, as long as you're getting at least that much and under 1,000, then you're good. You're going to be really good. But keep in mind your thyroid really only processes about 150 micrograms a day. All right. So thanks for joining me. I think I'll leave it there for with you leave you there with that. Sorry, I'm getting one more question. What is elemental iodine? It's it's like it's one of the elements. It's one of the natural elements in the earth. It's a vital element for our bodies, and it's like it's like sodium. It's like potassium. It's a vital element that we need in our bodies. All right. That's what iodine is. It's an element. And oh, another question. How much of these halogens? Okay. There's a few more. How much of these halogens should we have in our body? So really, um, I can't answer that. We don't really need fluorine. Okay, that is a toxic substance. We don't need fluorine. We don't need bromine. That is a toxic substance. So chloride, that form, we need chloride. Okay, we need sodium and chloride. We need some of that, but not chlorine. Okay, so it's altered. It's altered chlorine. Okay, that we need. Um, and wow, you guys are whipping them out. There's a lot of other questions. Um, maybe I can draw a picture of the molecules on the Facebook page. I maybe can do that. Can iodine test harm your kidney? No, no. So in explanation for why taking too much iodine causes Hashimoto's, it's because it like anything, too high a quantities, it gets deposited into your tissues, and your thyroid's trying to do something with it. And that's where the immune system sees something wrong. When the immune system sees something wrong, then it makes an antibody. And the definition of Hashimoto's is if you have antibodies in your blood for the thyroid peroxidase or for thyroglobulin. And thyroglobulin is what the thyroid makes and uses to make thyroid hormone. Okay. And nascent iodine is just another form of it. I mean, it tends to be a more chelated form, let's say. So it's not as structurally bound, strongly bound to like a salt, but it's still iodine. Now, it may be a more bioavailable form, which it is. But again, you still have to be careful about how much you're getting. Okay. And if you don't have a thyroid, what happens to storing iodine? Well, um, you don't have a place to store it. I mean, you simply don't. And so you definitely would have to be way more careful. You would not need iodine supplementation, okay? Because you're going to be taking thyroid replacement hormone, and that's where you're going to get, the hormone that you need, not from your own thyroid, but you know, from taking that hormone replacement. So you don't need additional iodine. Okay. Okay. Chlorine pulls iodine out because it binds stronger. It just replaces it. It kicks it out of its seat. It's a bully. Same with bromine and then fluorine. That's what happens. It's stronger binding, so it kicks it out of its seat. Okay? Okay. I am going to wrap it up there. Thanks for joining me. Iodine is it's an important topic. And and so thanks for joining me for Wellness Wednesday tonight. Hope you all have a wonderful evening. Remember, ladies, have hope. There are answers, and you still have the power to heal. Take care and have a great night, and we'll see you soon.